Hi, I'm Holly and I'm an Accredited Exercise Physiologist here at any.BODY Pilates and Exercise Physiology. Here at any.BODY we see a lot of women who are pregnant wanting to exercise and prepare themselves for birth, as well as postnatal, so wanting to rehabilitate and return to exercise or their everyday life. So I often see women who are recovering postpartum, and often we're looking at treating and managing different conditions like abdominal separation or pelvic organ prolapse, and helping women be able to either return to exercise or feel more confident during their everyday activities. So often the women that we see coming here will ask questions about returning to running after they've gone through pregnancy and had their birth. One of the biggest challenges that women face is particularly the uncertainty about whether they can run, whether they can exercise. And I think a lot of the time the uncertainty makes people quite worried and feel quite vulnerable, particularly for women who have an exercise history before pregnancy as well as during. It can be quite an adjustment to return to sport, realising that they have maybe a reduced exercise capacity, and that's something that we can help them with. So there are a few things that women should consider after they've given birth if they're looking to return to either running or sport. So we work with women to help them learn how to engage their pelvic floor, and we do so paired with exercise. It's a much more functional way to use the muscles. Another thing that we consider is the abdominal wall integrity, and the reason we do this is because often what people will get afraid of is leakage during running or some incontinence, and this can be linked to weakness or dysfunction within the pelvic floor. But even if the pelvic floor is healthy and strong, you can still experience leakage if the abdominal wall is not strong, or if you're not using those muscles the way that they're supposed to be. If we learn how to use these muscles paired with good breathing techniques while during exercise, there's a lot better function within them, and we can reduce the intra-abdominal pressure within the tummy, and that means that we're going to reduce that risk of leakage. And we also want to consider strength training as well, particularly in the lower body. And the reason we do this is because it's really beneficial for improving your lumbopelvic stability. So because of how much movement the pelvis goes through while you're giving birth, if it's a vaginal delivery, it's important to ensure that these joints are stable as well as strong, and strength training is the best way to support that. And the last thing that we want to look at is just taking into consideration that we always progress exercise slowly. So we're not going to go from doing no activity to running 10 kilometers. We're going to slowly introduce you to different durations, intensities, and distances with your running, and help you with specific exercises to make sure you can do that comfortably and safely. As an exercise physiologist, our role is to support women who have had a baby if they're looking to return to running. We do this by looking at all these considerations to help you program exercise that's suited for your individual needs.